So you say this like it's just like it's my job. But in reality, like, you're like saving the world.
Yeah, it's been an awesome experience. Everything shifted in February of last year. I was offered the opportunity to lead the university's plan for testing in the spring semester. And so in October was asked to start seeing what testing could look like. And a month later had basically a brand new instrument delivered to an empty bench space, started our own testing program, and as of this week have tested over 150,000 samples for faculty and staff to be able to keep our university safe and open.
The specialty of family medicine is just as complex as being a nephrologist, being a CT surgeon. There's an art, there's a skill, there's expertise to being able to speak to a person and to draw them out, to hear their story and translate it. And that story is so much richer and more vibrant when I'm able to see that person over the continuum of their life. How do you do that so that person, whether they're in rural North Carolina or in another country, understands what you're doing and how you're able to help them? Because many times people are asking, they don't know what's wrong with them. They just need you to help them.
When you get to go to work every day and you get to work with patients and help them on their way, their journey to health, and you get to work with people who are also so inspiring, that's really how you end up loving what you do. Monitor what your needs are, what your family's needs are, what the community's needs are at that time, and fill those needs. But then that doesn't mean that you have to do that for 40 years. You could do that for 5 or 10, just change it around.
I didn't realize how many different routes there were in family medicine to do so. And I also didn't realize how many of the interests that I had could be really done in the world of family medicine. I remember very distinctly in some of my third-year medical school rotations, walking into patient rooms and only being able to take care of that person in front of me because I couldn't talk to them about their children because the group that I was rounding with didn't have the ability to take care of pediatric patients, or I couldn't talk about the laboring mom when I was taking care of the pediatric child that was just born because that was the job of the other service line that was involved. When I saw that, it didn't feel right to me. And so what I wanted to do was find a field that would give me the opportunity to be able to do that. And that's what family medicine did for me. It gave me that chance to be able to step into any scenario, any room. I'm not gonna just look at that one piece of the puzzle that's in front of me. I'm gonna try to put the whole puzzle together. That's why I get excited every single day to come to work. Every day is a new day, there's a new task at hand, and there's a new opportunity to succeed.
We are all intersectional, and the more that we can bring all of our identities into our professional realm, we are better problem solvers. We are better clinicians. We are better, just caretakers for our patient. We are better workers in our clinical context. There are not many family physicians who are C-section trained and are a medical director for a unit who look like me. So that's important for more and more people to really broaden and increase the diversity to solving our problems. So teaching people how to understand that system and teaching them what is the part that they can change and what is a part that you can step into a larger arena to change.
Thinking about the opioid crisis and how do we prescribe opioids more safely and how do we start teaching about this and learning about this. When I came here, we didn't really have a program here, and so we were able to start that and get residents trained in treating opioid use disorder and faculty trained, and so now we have a pretty robust program.
We have to take every experience knowing that there's something bigger than what's in front of you. It's not just that patient that you're talking to, it's their family, it's the community that they live in. No way this is a single person job. There's over 1,000 people that are involved in helping make sure our testing program is working. I just get to be lucky enough to help kind of put those pieces together and orchestrate that. It's always important to treat everyone with respect and know that they're there because they trust you, they want your expertise, and we're all here together to make it work better.